Welcome to class, everyone. I'm happy to see everyone. I'm glad everyone's camera's on, and thank you for telling me a little bit about yourself. We're just going to go over what the expectations are for this course, and then we'll take a quick break and we'll jump into the material for this week. So I think all of you have had online classes before, but I just want to make sure everyone understands the expectations for the course, make sure everyone knows the attendance policy, etc. So this is the basic information about online learning. So obviously, since we're not in class together, it's harder for you to interact with me because you're not going to see me face to face, but I am open to meeting with you outside of class. You just need to send me a message. You can send me an email, send me a text message to my cell phone. I'm available to meet with you one-on-one whenever you need to. And just in general, throughout the course, you should be really logging on to the campus shell throughout the week, making sure you're doing your homework on time. If you do all of those things, if you keep in touch with me and you participate in the discussion questions, then I think that you will find that even though it's online, that you feel like you get to know me and the other students. If you're having any issues, that I should always be your first contact. So at the bottom of this slide here, it has Darlene Brown's email and phone number. And if you have any concerns about my teaching or my policies or anything that's going on in class, you're welcome to go to my boss, which is Darlene Brown. But I really appreciate it if you would come to me first if you have any problems or if I can help you in any way. You can always send me a message in Canvas, or you can also send me an email. I put in the Canvas shell my cell phone number, and I'm going to tell it to you now. I'll also put it in the chat. I don't teach full time, so I'm not always on the internet. So if you need to get in touch with me, and students do this, on a pretty regular basis, and I don't mind, you are welcome to send me a text message. Let me put it in here for you. So my phone number is 208-763-8716. So, if you text me at midnight, I'm not going to get back to you right away, but, Monday through Friday until like 6, 7 p.m. in the evening, and then until, I don't know, 2, 3 on the weekends, I'll be around and I'll respond to text messages. So if you're stuck on your homework assignment, if you're not feeling well, if you have a doctor's appointment or something that, I need to know, I don't have any problem at all if you send me a text message. Obviously, I don't want you to abuse that, but if you send me a message on email or in Canvas, it could be 24 hours before I get back to you. So if you need a response before 24 hours, you are more than welcome to text my cell phone number. So, throughout this course, kind of my responsibilities is to be available for you, to respond to any of your concerns, help you out, give you feedback, grade your homework on time, etc. So if you feel like something's not working with how this class is being run, then I'm very open to feedback from students. So please reach out to me and let me know. Generally speaking, I want to make sure that we're all being polite and respectful to each other. So I pledge to you that I will, if you're angry about something, I won't reply with anger. We'll listen to you and have a conversation with you, but I really hope that you treat me the same way, so that we both treat with each other with respect. You guys are going to be professional nurses, and so kind of learning that communication and treating me and your other classmates with respect is really important, even though we're all in this online world. So I think many of you have heard that we're being pretty strict with attendance. So I want to make sure everyone understands the attendance policy. So everyone has their name on the Zoom log. So at the end of class, I go into Zoom and I print that attendance log out. And that is what I use to determine if you were here or not. So I don't have any choice. Like if you're absent, I have to mark you absent because I have to send that attendance log to your schools to prove that you were in class, and they audit me. So, if you have something going on, you need to let me know in advance. But you do, if you can't attend other teachers' classes, you can't attend my class on Monday if you have something on Tuesday. This is your priority for this term, is to come to class on time and to have your camera on. So I treat all students the same. So I'm not going to let one student have their camera off and tell other students they have to have the camera on. So everyone needs to follow the rules. And if you have any questions, you can send me a message. There's a lot of homework I'm sure you'll see when you're going to Canvas. So the discussion board is a big part, and it, keeping up with the discussion board and answering your questions is going to help you do well in class. So you should be posting your first discussion post by Wednesday and then responding to 2 of your peers by Sunday. So the shell should be updated with the dates, and the syllabus is also in there. But if you have any questions about that, there's 2 discussion questions this week. There's the orientation question, like my name is, I go to whatever campus. And then there's the week 1 discussion. You only need to reply to 2 of your peers for the week 1 discussion. The introduction, you don't need to reply to your peers. So I understand people have a lot going on in their life, but I'm really, really flexible with students if they let me know in advance that something's going on. So if you are sick, if there's something's happened, you need to go out of town for whatever reason, and you can't turn your homework in, you just need to let me know in advance, and I can give you a 1-week extension. If you come to me after something was due, I can't let you turn it in late. And this is the same thing that, I have to treat all students the same. So, just make sure that if something's going on in your life and you're not going to get your homework in on time, that you tell me in advance so that I can give you an extension. And you'll get a 10% deduction, but only if you get prior approval. If you don't tell me in advance, you'll get a 0 if you don't turn it in on time. So this is a little bit more about the attendance policy. I talked about having your name in Zoom so that I can print that information off and give it to the registrar. So another thing that's really important about the attendance is that if you miss class for 2 weeks in a row, so 14 days in a row, then you're automatically dropped from the class. So you need to make sure, I totally understand if, you have to miss class one time for whatever reason. I'm not trying to insinuate that we don't all have lives, but it's really, really important that you understand if you miss class for 2 weeks in a row, you're dropped from the class. So you need to make sure that, you follow up with me, you let me know what's going on, and that you don't miss 2 weeks in a row. You need to have your camera on. It needs to be at you. You can't be in the car. You can't be in the bus. You can't be at work. You need to be like in class paying attention. And in terms of the class time, so if you're late to class, I'll still mark you as being here, but I will mark you as being late. So attendance is recorded in 15-minute intervals. So if you're 10 minutes late, you'll be marked absent for 15 minutes. And it keeps track of how many minutes you're absent in class in your registrar log. So if you're 15 minutes late a lot, that will add up over time. So this is just kind of reiterating that information about attendance being taken in 15-minute intervals. And it's important for you to know that if you miss 20% of the class time, then you'll be dropped a letter grade. So there's 2 things that are really important to know. You can't miss 2 weeks in a row, you'll automatically be dropped. And if you miss 20% of class time, and that's cumulative, so if you're consistently late and it adds up to 20%, then you'll get a full letter grade deduction, which would be terrible, right? If you had an 82, you would be dropped to a 72%. So you need to make sure that you're not hitting that 20% threshold. You'll get email reminders throughout the term if you're not coming to class. So if you're at 5%, you'll get an email. Once you get 10%, then you have to meet with me. And if you get to 15%, you're going to also have to meet with campus administration. And then when you get to 20%, that's when you get your one letter grade deduction in your course grade. So does anyone have any questions about the attendance policy or how I take attendance in class? No, everyone understands it? Okay. Generally speaking, doing your work on time, staying up on the homework, coming to any review sessions that I have, making one-on-one tutoring sessions with me, those are all things that will help you succeed in this class. So I think that all of you, you're all adults, you've been in school for a while, so you know the importance of like making sure that you have someplace quiet to study, that you make sure that you have good internet connection, that you read the assignments carefully. So these are all just some tips. I think they're probably things that you know, but I just want to make sure that we're all on the same page and everyone knows the expectations for this course. And something that is also different about this course this term is that we're going to be taking quizzes in class. So you guys, when you log into Canvas and you take a look at when everything's due, you're not going to see any of your quizzes. So we turn them on during class, you take them during class time, and then we turn them back off. So if you're not in class for whatever reason, then you'll get a 0 on your quiz. And there's 5 quizzes throughout the term. So we have a quiz next week. So week number 2 is quiz number 1. So I just want to make sure everyone knows that you need to be in class for your quiz. So I'll try to tell you in advance. I'll put it in the announcements always that we're having a quiz, and it's in your syllabus, but the dates aren't in the Canvas shell because if we put the dates in there, then we would have to turn the quiz on. So does anyone have any questions about taking the quizzes during class? They're 10 question quizzes. You'll have 15 minutes. We'll take them at the end of class. And then you'll be free to go on the weeks we have a quiz. When you're done with the quiz, you can leave. So I think you guys all got into Canvas. You know how to use Canvas infrastructure. If you have any questions about the course material, then you should come to me. If you have any tech questions, you should really go to IT. So you will get more out of this class if you do the reading, if you can at least look at your textbook before you come. I'm going to point out key points, but there's a lot of reading in this class and I can't go over everything that's in your textbook. I'll do my best to make sure that you guys know, what you really need to focus on, but the lectures will be more meaningful and you'll get more out of this class if you can look at your reading before you come. So we do exam reviews. It says weekly review sessions. You can meet with me weekly if you want, but we definitely do exam reviews. So you have 3 exams in your HESI, and all the teachers do an out of class exam review that's recorded, and you get a PowerPoint or a worksheet to go with the exam review. And then we share that information with the other instructors. So you can either come to my review or there's 2 other instructors that are teaching this class. So you're welcome to go to anyone's review. You can go to multiple reviews. We know what's on the test. We know what to kind of guide you to. So I certainly think that you will do better on the exams if you make sure that you come to the exam reviews. And then in addition to that, I'm available for one-to-one tutoring if you ever need it. So I think everyone understands this, but who knows how high your KGA has to be to pass this class? Who can tell me what KGA you need?
78.
What percentage? 78. Okay. So these are your KGA items, your unit exams. There's 3, there's 5 quizzes, and then there's this HESI, or this pediatric special exam is your HESI. So these 3 things make up your KGA. So it has to be above a 78% for you to pass the class. And then once you hit that 78 threshold, then we add in your homework. And these items here, are your homework items. So I want to make sure everyone understands that, so that you can kind of judge how much you need to study or where you are, how you're doing in the class based on the fact that you really need that 78% KGA. So since the KGA is so important, we leave the homework scores off at first. So what you're seeing is your KGA. So weeks 1 to 5, the homework scores are turned off. Week 6, we turn them back on. So you can see how the homework is affecting your grade. And then we turn them off at week 8. So you can really see what you need on your HESI to meet your KGA threshold. And then we turn them back on once everyone's HESI score has been updated. So this is just reiterating this points about, you need the 78% KGA. And this goes over the quizzes. They're taken in class times. There's a total of 5 quizzes this term. You only get 1 attempt. There's 15 questions. And then, I'll be here. If you're having any technical problems during the quiz, you need to let me know when you're taking it. I think you guys have all used ExamSoft before, so all of your exams will be taken in ExamSoft, and it's really helpful if you could download the exam before you come to class. It makes things go smoother. I'll be checking your ID when you log into class and making sure that your name, everything matches. And then this term, you will need to come back after your exams and we'll have a lecture after class or after the exam. Does anyone have any questions about using ExamSoft? Everyone's used it before?
Yeah, do we have to have the second device set up?
You do. So you should be your cell phone so that I can see everything. So you'll take your exam on your computer and then have your second device and have it's usually your cell phone, but it can be whatever has a camera on so that I can see you in your work area when you're taking the exam. Yeah.
Can we take the exam at school?
You can. there were a bunch of students last term from Essington that would take it on campus with Donna, I think is her name. She's one of the admin assistants. And it's fine with me, but you need to arrange it with me in advance. So you should give me 72 hours notice is ideal. So you need to, talk to Donna, make sure that she's okay proctoring you or whoever. Last term for Essington, it was Donna. And then I send Donna the code. So then if you take it on campus, you go to wherever Donna tells you to go, and she gives you the code and she proctors you. But it does, you need to let me know in advance, and it's best if you take it during your exam time. So, Tuesdays from 9 to 11 Eastern is your class time. So if you could take it with Donna, say, from between 9 and 11. Okay.
All right. Okay.
And then, obviously we all have technical problems. So if you have any technical problems during the exam, you need to let me know as soon as it's happening so I can try to problem solve with you. The exams are timed, so make sure that you're keeping track of how you're doing during the exam and giving yourself enough time. Sometimes students have accommodations, like they have ADHD or they have dyslexia or something where they need a little extra time to take their exams. I don't always get those letters right away. So if you have one of those accommodation letters where you get more time for your exams and your quizzes, please make sure I know it so that I can set up everything correctly so that you have the extra time that you need. This slide also has that proctoring. So, make sure that you're giving me advance notice. I don't want anyone calling me the day of the exam and telling me they're on campus. So let me know in advance so that I can make sure that you have an appropriate proctor and I can get the code to that proctor. And this is some more information. You have to have your camera on, your ID on. I have to be able to see, so that second device so that I can see what's going on. You can't have anything covering your ears. So the exams are held to the late work policy, which means that if you're sick, you need to let me know before the exam time that you're sick. So I'm happy to work with you, but you can't let me know after the fact why you weren't in class. You need to let me know it beforehand, and then I will make a plan with you for you to take your exam. So this is kind of reiterating this. Tell me before. If you tell me after, then I can't help you, and I have to, be strict and have the same rules with all students. So please let me know in advance if you're having any issues or if you're sick. So that is the end of the information on taking the exams and the KGA and the attendance policy. Does anyone have any questions over that first part of this presentation? So we're going to go over the rules for the homework assignments, etc., to make sure everyone is on the same page. So there is quite a bit of homework in this class. So make sure that you're planning ahead, looking at your syllabus, figuring out when things are due, come up with a step-by-step plan for how you're going to get everything done. This is an example of a calendar that you might do if you're one of those people that really likes to write things out. Something like this might be helpful. This goes back over that late work policy. So, and to be honest with you, when I set stuff up in Canvas, I have an end date. So if you're not turning stuff in and then you try to log in, it won't even be available to you. So make sure that you're getting your homework in on time. And if you need an extension for whatever reason, you need to let me know, and then I will give it to you, but you will get a 10% deduction. You have a lot of NCLEX questions. I think they're due 5 times throughout the term. And there are instructions in there on which subsections you need to select, etc. The one thing that I really want to point out is make sure you follow the instructions for generating the PDF. So I won't accept screenshots. So you need to make sure that you download the PDF and then upload the PDF into Canvas. So for this one, you can practice the NCLEX questions as many times as you want. So, you can keep doing it over and over again until you get the score that you want, and then just upload the PDF with that score. So if there's 50 questions and you get 40 correct, then you'll get 40 points. 40 out of 50 is 80. So I just look at the PDF and make sure that you follow the instructions and then give you the number of questions that you got correct. So I'll never know how many times you did it. So, you're kind of in control of your own grade. for the NCLEX questions. That is different than the case studies and the practice exam. So that is set up so that it comes over automatically. You're going to log in. You have to use the link that's in your shell to get to the case study and the practice exam. And then that grade comes across automatically. I don't put it in, and you get your first score. So you can't do your case study multiple times. Whatever you get on your case study the first time that you do it, that's the score that gets inputted. So make sure that you're following all the instructions and make sure that you remember that it's going to be your first attempt. You don't get multiple attempts on your case studies and your practice exam. And also just make sure you're going through the Canvas shell. Sometimes I don't understand why students want to do it other ways, but for whatever reason, if you feel like you're not able to use the Canvas shell, if there's something going on, first of all, let me know so I can figure out if I did something wrong, that I set it up wrong. But if you need to do it any other way, that you have to get approval from Darlene Brown, I can't give you approval to do anything else other than to use the link that's in Canvas. And this is kind of reinforcing those points that they come across automatically. And then I don't take any screenshots. And if you get in there any other way to take it, you'll get a 0. Just so make sure everyone knows that. So you guys don't have any papers this term, but you do have several different discussion questions. I think there are 7. So this kind of applies to the discussion questions. Just read the instructions. I want everyone to do well. So I'm generally going to give you some leeway with the discussion. I want you to participate. I want you to answer the question. But, the main thing is that you post by Wednesday and you respond to your peers by Sunday, and that you cite your source. And then make sure that whatever you post really answers the question that's being asked. There is a specific rubric that I follow. It's not this one here because you're not writing papers, but as long as you're following the instructions, then you'll get full credit on your discussion questions, but you need to make sure that you're following the instructions. This doesn't really apply to you in terms of only using journals, etc., because you guys aren't writing any papers. But you do need to cite your sources for your discussion questions, and it's fine if it's your textbook, but you need to add that to your first discussion post. So I mentioned this earlier that we're going to do the quizzes in class. So you won't even see them until I turn them on during class time. And, if you have any problems, we'll all be in class. I'll probably just ask you to wait until the rest of the class is done taking, and then I'll go ahead and go over everything with you to figure out what your technical problem is. And this applies for exams also. If you're having any problems, you need to let me know at that moment so that I can, if it's exam, take you to a breakout room, or if it's a quiz, wait until the students are done and we can problem solve together. So don't try to take an exam or a quiz if you're having any technical problems, because I can't go back and give you points, but I can help you figure out what's going on in the moment. So all of you are going to take an HESI, your pediatric HESI, at the end of the class. You only get 1 attempt. So I know sometimes students, unfortunately, like maybe they won't do as well as they wanted to on their HESI, and then they'll ask for a second attempt. And the answer is always no. Everyone only gets 1 attempt on their HESI. It is 20% of your grade, so it is an important score. But also, if you're paying attention during class and you're coming to all the lectures and you're studying for your tests, then you should do fine on your HESI. It's really the same information. The general benchmark is 900, and there is a remediation policy. So, if you get around a 900, then you only have to do 1 hour. Whereas if you score a 600, then you need to do 7 hours. So no one gets their HESI score until they finish their remediation. So I just want to make sure everyone understands, even if you're around that 900 range, you still need to log in into your remediation, and it's going to be due, Tuesday morning of week 12. And unfortunately, you really will get a 0 if you don't remediate. And it's based on the number of hours, not if you get the green check mark. So go ahead, Kiara, what question do you have? Or I'm sorry, Carmela.
I took my HESI already, so I'm repeating this class. I just wanted to know that because the case studies and all of those things, my NCLEX, like all of that stuff is already completed.
Yeah, you
I wa-
still need to do, yeah, you'll still need to do them.
Okay.
Okay. I know, but I mean, it's a good review for you, but you still need to turn the homework assignments in when they're due.
Right. So the only thing I have a question about is the case studies because I'm not sure like you like in the other questions
Yeah.
the something I don't think that they come up like fresh over again. So I'll just be like turning in the completed work already. I'm assuming.
So go ahead. I've had students repeat before and they were able to redo their case studies.
Okay. I
So
just want to
if,
make sure.
yeah, no. Thank you for bringing it up. If for some reason you get in there and it won't work, please let me know. But you should be able to redo the case studies.
Okay. And then what about the HESI? Because I already took that as well. So do I
Yeah,
get another try or?
you do get another try. It's like one try per term. So you're not,
Okay.
yeah, like if you didn't do well on your HESI and you were like, no, but I'm only 2 points away, can I retake it? The answer is no. But yeah, at the end of this term, you'll take the HESI with everyone else.
Okay.
Okay, thank you for asking, Carmela. So I'm sure everyone knows here that, there's exam security. So you can't, you either will take it on campus or you'll take it with ProctorU. And if you'll have like a ProctorU training, has anyone taken the HESI on ProctorU before? No one
No,
has
for Essington, we
experience?
always go in campus.
You always
Yes,
go on
I've taken it on ProctorU before.
And how did it go?
It's difficult. You have
Okay.
to wait for someone to come in and it's a lot of instructions. So it's better to just go to the campus.
Yeah, if I had one thing to say about it, I would say go to the campus. I'm
Yeah,
glad
it's
you
a
said
lot.
something. It's
It feels
and
as if
I
you're
had
going into a correctional facility or something.
yeah, and they're very strict.
Mhm.
And it can really, I think that for students where they don't have any issues, it's probably fine. But if they're like worried about your desk setup or they start asking a bunch of questions and I don't know, for whatever reason, they think you're cheating for whatever reason, then that kind of sets you off and you get kind of stressed out.
Yeah, once my computer started echoing and they thought I
Oh,
was talking to someone and he came in, I'm like, no, it's my computer, the microphone. Yeah.
Yeah. So thank you, Denicia, for letting us
You're
know, because
welcome.
I had several students last term that really hated ProctorU. So I mean, it's it's up to you. You're adult learners. It's sometimes people really don't want to go into campus, but for sure, do the dry run. Make sure all your equipment's working before you try to do anything in ProctorU. Have your exam area all set up, but it can be stressful just because they have to be so strict, right? So then they start questioning every little thing and then it can kind of throw you off. But those are all of you will have one of those. You will either do it on ProctorU or you will do it on campus. All right, let's see here. These are some basic information, for your HESI. Make sure that you have the day off work, if you work, that you've studied, that you've had enough sleep, etc. Does anyone have any questions about any of the orientation material? Okay, so I'm going to go ahead and give you guys a brief break. So if you guys can come back at 10 a.m. Eastern, so it's about 12 minutes. And then when you come back, we'll start the information for this week. So I'll see you guys in a few minutes.
What is going on? I don't even know.
Please hold and we will be with you shortly. Calls are recorded for quality and training purposes. Concierge care, this is Danielle. How can I help you?
Good morning, Danielle. This is Denise Warren. I got a text
Miss
from,
Denise,
Miss Denise, can you mute
you
your
need to
phone?
mute your screen.
I got a text from,
It's not
We can
muted.
It's
still
still
hear you,
on.
Miss Denise.
Sarah.
It's still
I'm
on.
sorry. I'm in class and I shouldn't be on the phone, but I was calling, I was responding to her. And she was inquiring about my shift and my availability.
Yes.
So
So what days are you available?
I first off, can I say this? I'm not going to be able to do Frank on Tuesday, the 18th, because I just
Miss
forgot his
Denise.
schedule. They changed my schedule
Miss Denise,
from last year. So I will not be able to
Miss
service him
Denise.
that morning at
Denise.
I don't
7
think
to
she can hear
11:30
us. I think
because,
she put her
Oh, wow, we
computer
can hear her
on-
entire
on-
conversation.
Okay,
Okay.
that's fine.
on the 18th, but I'm able to pick him up in the afternoon.
Maybe the teacher can mute her.
Tuesday and let me see, Tuesday and Thursday. Tuesday, yeah. No, just Tuesday. Tuesday, I'll be able to do him on Thursday. I'm looking at it. So Monday, go to class from 9 to 3:45. I can't do Mondays.
So
I'm
that's
just-
Tuesday. Oh, that's just that Tuesday. Okay. So
I could do them in the afternoons. Look like I'm looking at my schedule, my class schedule, and because I write everything down. So the way it's looking, that I know I have class on Monday all day. I'm in class all day, and my times.
so you want the afternoon?
Yeah,
on
if I
Tuesday?
yeah, I could do him on the afternoons. I can definitely do him in the afternoons on Tuesday for sure.
Okay. Is there any other afternoons you want with him?
Ew. I'm looking for hours. I'm gonna have to. Can I pick him up on I'll say Sunday afternoon.
You want Sunday afternoon too?
Right now, yes, for right now. A couple of weeks.
Okay, you want that ongoing?
I'm really looking for a full schedule. I mean, overnight. I'm really looking for overnights. That's my main thing.
Okay, so before I put you on that,
Talk to me.
Go over
Yes.
what you're looking for. So you're looking for overnights, right?
Pretty much. It's easier for me.
Okay. So
And I know I'm available on Saturdays, overnight, and Sundays, overnight, but I can't work past 7 o'clock.
7 o'clock in the morning?
Yeah, on Sundays, on Sundays.
So
And how are you on Thursdays, for overnights? What do you look like? What did it look like for you?
So this Thursday, the overnight we have has been taken.
Sure.
We do have a new client that started, and we are looking for overnight for him.
Yes.
He's in Port Orange.
He's in Port Orange. Okay. What is his hours?
It's 8 a.m. to 8 p.m.
Okay. But you don't have no overnight.
And he's available ongoing overnight.
Oh, okay, so you do have ongoing overnights. Okay, I can, because I was waiting on a case in St. Augustine, but this lady's only doing like weekly stuff, so I can't depend on that. I need something, I need to know where I'm going. So I can do him
I could put you on him
for Thursday,
Monday,
Monday,
Tuesday,
Tuesday.
and Thursday overnight if you want.
Okay, Tuesday, I'm kind of knocking it, I'm pushing it because I have to be in class at 9. So I know I can do Tuesday night. I know I can do Thursday night. And what other night you had available? Wednesday?
The issue with Wednesday is you have Frank.
Okay,
or
yeah.
the issue with Tuesday night is you have Frank at 7 a.m.
Okay,
Thursday.
this week.
next day.
Okay, what about the following week, the week of the 24th?
No, that was the following week. Oh, the week of the 24th.
Yes, ma'am.
You don't have Frank at all.
Okay, so can we work with this gentleman during that time?
So I could put you on next week if you want Thursday
Yes, ma'am, I do.
night
Yes, ma'am.
and Wednesday night.
Okay, and I do not have Frank on Saturday night either.
You have Frank Saturday evening from 4 to 8.
On the 22nd?
Uh-huh.
I do. Okay, let me put it down. I didn't know. I don't have it on my yeah, let me write it right now. I don't want to, yeah. I'm glad we talking because I sure would have never known. Okay, I got you. All right.
So you want Wednesday and Thursday next week? What happened?
Yes, ma'am. Ma'am?
All right. Let me go over his care plan with you.
Okay.
So he's a Hoyer list for all transfers. If not, you'll have to support him with transferring. He's a
Okay.
hands-on assist at all times. He ambulates with a wheelchair. He wears briefs for accident protections and mobility. Assists with toileting. Empty and clean commode and urinal as needed. Sun bath daily. Full assistance with dressing him. Encourage exercise. He has a lift chair in the living room to assist with transferring him also.
How big is this guy?
He is 190 pounds.
Uh-huh.
You'll be with him overnight, so it shouldn't be too much.
Too much. Okay. I just don't.
Transferring.
Right.
So this is more like his daytime.
Yes, ma'am.
I don't see you having. He wears briefs for accident protection.
Sure.
So I don't see you having to move him too much because it is overnight. This is more like his daytime.
Okay, love.
Do you want him?
Yeah, I can do it Wednesday and Thursday. And if it works well, I probably could pick him up. Well, I got Sarah on the 26th, but I could pretty much pick him up on Thursdays easily. And
I can put you on this Sunday overnight if you want.
This Sunday.
Also.
Oh, I already have somebody overnight in Polite. I'm at St. Augustine this week.
Okay.
Yes, ma'am. Because I would have took it
So Wednesday and Thursday.
of this week. Yes. That's the 19th and the 20th.
Yes, ma'am. The hourly rate is 16.
It's 15.
16.
All right, Danielle. I don't usually work for that, but I'm gonna take it from you this time.
Okay, I'll talk to Serenity.
At 17 is my
If you
minimum.
take
Yeah, I usually start
him-
at
If you take
17.
him ongoing, I'll talk to Sarah and see what we can do, okay?
Sure, that'll work for me.
Okay,
Okay, baby.
alrighty. Hold on.
Because I'm so trying to pick him up on Sundays, if I could.
I just realized I was on mute. Sorry about that. So welcome back to class, everyone. As soon as you get a chance, please flip your cameras back on, and then we'll get started.
And you say he's in Port Orange, correct?
All right. Thank you, Carmela. Looks like we're just, maybe it was Nakia was having problems with her camera. Nakia, if you get a chance to please put your camera back on. Thank you. And then Samuel, go ahead and flip your camera back on, Samuel. Thank you. Okay, so we're gonna go ahead and get started. There's 3 chapters this week. We're not gonna have time to get into all the information on all the chapters, and we also have a couple videos to watch because I think the theorists are easy to understand with a couple of videos. So we're going to start going over the information, and I will point out some key information. I want everyone to remember that we do have a quiz next week. There's a Kahoot this week that we'll do at the end of class, and there's also a Kahoot next week. So I always make sure that if you're paying attention to the Kahoots, you should do okay on the quizzes. So I just want to make sure everyone kind of has their eye on that when you're preparing for the Kahoots. So I'll put preparing for the quizzes. I'll put the Kahoot in the announcement so you can study it after class. But the quiz that's next week is going to go over information from this first week. So we're going to start with just basic information about growth and development in pediatrics. So, unlike adults, they're obviously still growing. So generally speaking, growing kids, it's growth spurts followed by plateaus. But it's pretty predictable. We have certain benchmarks throughout childhood. It's important to remember that kids don't mature at the same pace. Every kid's different, and not all body parts mature at the same pace either. For example, your kidneys are not fully mature till you're around 2. There's a lot of differences between kids and adults. So just kind of remembering that kids are not mini adults. An example back to the kidneys aren't fully developed until around age 2. So kids are at higher risk for like medication toxicity. They're also at higher risk for dehydration because they have a higher body surface area. So there's certain things about the kids' anatomy that just kind of make them at a higher risk for, reactions to medications or specific disease processes than adults. So there are some key things that we are always doing during well child visits, and you're always going to be thinking about your nursing process and how what you're doing with your pediatric patients when you're seeing them fits into the nursing process. So, who can tell me what the 5 stages of the nursing process are? What's the first thing?
The first one is assess.
Assess. And then, so there's a way to remember that I think I remember it is this add pi. So it's assess. And what's the D stand for?
Diagnose.
It's going to be data collection.
Oh, data collection. Okay.
And diagnose. Yeah, you're right.
Planning.
And then what's the P?
planning,
planning, what's the I?
implementation,
Mhm. Yeah,
and evaluation.
very good. Okay, so you're gonna look at your patient, you're gonna do your and I'm sorry, because I kind of was looking at the slide and not remembering in my brain. So you're right. So when your data collection is going to be part of your assessment. So don't put this with the D, put this with your A. So your assessment is also going to be your data collection, your height and your weight. And then you're going to analyze and get your nursing diagnoses. Then you're going to plan based on what you analyze. You're going to implement your plan, and then you're going to reevaluate. So you're always going to be thinking about where you are in the nursing process when you're taking care of patients. And there will be some questions on your tests where they ask you where you are in the nursing process. So to just kind of remember that. With kids, part of your assessment is always going to be, their height, weight, and putting them on a growth chart, and, interviewing the patient and the parents. And then once you have some information, that's when you're really going to get your nursing diagnoses. And then you're going to think of how you're going to address that nursing diagnosis. You're going to implement your plan, and then you're going to evaluate. So some things that, you're going to be paying attention to. So like if a kid's really off the chart for their weight, what sort of nursing diagnoses might you have? If they're really, really big, they're really overweight.
Obesity.
Obesity, obesity at risk for a lot of different problems, a risk for hypertension and obesity. So what type of plan do you think you would put into place? What would you do as a nurse?
A dieting.
Yeah, so you're going to provide information on dieting. We're going to give parents some healthy tips, maybe the plate method, how to eat more vegetables in your diet. How are you going to implement your plan?
Like give the parents guidance about like healthy eating
Yeah,
habits.
maybe it's either going to be some handouts or referrals to a nutrition center, or maybe help them get an appointment with a nutritionist. Okay. And then how are you going to evaluate?
See if it's working after like a month or two, if the child is losing weight, if they're
Yep, so you're
getting better.
Very good. So you're going to have them come back in, and you're going to reweigh them, and you're going to see if it's working. And then you're going to start over at the beginning where you're going to start your assessment all over again. So just to kind of have that, it's a good thing to think about having your mind when you're thinking about taking care of your patients. So you guys did great with that. There's a couple of terms that I don't know if you've seen in other classes, and they're just what we talk about, directional patterns of development. So this is the kid's head here, obviously. So cephalcaudal is development from head to trunk or tail. And then proximal distal is development from the midline out. So cephalcaudal would mean like you have head control before you have trunk control. Also think about like babies, they're born with a really big head that develops before really the rest of the body. And then proximal distal, they have like tummy control before they have hand control. And they move their arms before they move their fingers. So, these are the two ways that kids tend to develop, with head control before like control down here, and then also control in the middle of their body before the external part of their body. So moving arms before moving fingers, moving legs before moving toes. So these two terms you need to know. You'll see these both on your quizzes and your exams. So there's, certain things that you need to think about in terms of kids. We talked about like their kidneys not being as mature. What do you think about their cardiovascular system? What is different about a baby's heart rate and blood pressure? Is it the same or different than an adult's?
Heart rate is higher, blood pressure is lower.
Very good. And how about respirations?
Higher.
Higher. So what would be like a normal respiration for like a 2-month-old?
Like 18 to 20, I think.
It'll be even higher. It'll be around 40. So I'll send you guys a little vital signs by age, but it's really important to kind of remember that babies, like, they tend to breathe really fast. It looks fast when you count it, and also their blood pressure is lower and their heart rate is higher. And just kind of remembering, they don't really have the same immune system. So how do babies get immunity? Do they get immunity from their mom? How else do they get immunity?
Immunization.
Mom.
They get immunity through immunizations. And they also, if they're breastfed, they get some immunity from their breast milk. And then, remembering that babies don't sleep the same way as adults. They're still really growing. So they're having a lot of bone growth, and they're having to learn a lot of new skills just to get through infancy. So when we always do height, weight, and then head circumference up to age 2 at every well child visit. So these are examples of the 2 growth charts that you're going to see if you ever work in a pediatrician's office or a family practice. You put your height, your weight, and then the head circumference also. And the blue is for the boy and the pink is for the girl. So there's a couple things, not all babies grow the same. But one of the things that you talk about is you want, it's the ideal if a kid follows their curve. So, because here, this is going to be age in years. So you have like a 3-year-old here, and they're like 12 kilos in here. So that puts them on the 25th percentile. You'd follow all the way up here to the 25th. And that's kind of small, but that's not necessarily a problem. It would be a problem if they were here on the 25th percentile and then they jumped up or they jumped down. So the main thing with kids when you're plotting their growth, it really should be like, it should follow whatever curve they're on. So you worry about big changes in their curve, not necessarily a change in their weight or their height, but if you see them jump up or down on these curves. And then it's a problem if they're really like below the 20th or above the 20th or above the 80th. So like on either end of the spectrum, if you're below the 20th, you're really small. If you're above the 90th, you're really big. And then anything in here is normal, and it's ideal that they just kind of follow their curve. So in addition to doing the height, weight, and head circumference in the office, a lot of times pediatricians' offices also do what they call a Denver developmental screening. So they look at 4 aspects: personal, social, fine motor, adaptive language, and gross motor. And it gives like a general understanding if the kid's developing normally. So one thing that you need to make sure is you tell parents that this is not an intelligence test. This is just a screening test to see if there's any red flags. So what could be going on? Like if you have a 2-year-old that's not talking, 2-year-old should have like 2-word sentences. So if you have a 2-year-old in your office that's not talking, what sorts of things could be going on that could be preventing that kid from learning to speak?
Autism.
Could be autism. Very good. What else could be going on?
Trauma.
Mm-hmm.
Abuse.
There could be trauma, abuse. Yes.
They could just have a language delay, developmental delay.
They could have a developmental delay. They could have a hearing problem. Like you can't really learn to talk if you're not hearing normally. So, just because you notice something, it could be all of those things. Those were very good things for you to point out: autism, abuse, trauma, etc. But maybe they just don't hear well. So when you do the screening test, you're not diagnosing them with anything. You're not definitively determining that they have autism or that they're being abused. You're just saying they're not learning language in the way that they should, and that needs to be followed up on. So you need to make sure parents, when you're doing it, it's not an intelligence test, it's a screening test. And then you're going to identify any red flags and then get the kid the help that they need to address whatever is going on. So a lot of things influence how we grow. So heredity, nationality and race, your position within the family, your gender, and your environment. So sometimes kids or students don't always understand this. This is going to be like if you have 3 kids, the older kid may have talked really early in childhood, and then the 3rd child doesn't want to talk at all. And sometimes that's because the older kids speak for the younger kids. Like kids have a way of communicating and they kind of understand what each other wants. So then, you have your 7-year-old, your 5-year-old, and your 2-year-old, and the 2-year-old isn't interested in talking, but the 7-year-old and the 5-year-old say everything for him. So sometimes that ordinal position in the family kind of influences how the kid develops. We have to think about a lot of different things. If you have a homeless family, That doesn't necessarily mean that the kid is being abused, but as a nurse, you need to be making good referrals, to shelters, making sure that they have enough food, they have access to healthcare, education. There's a lot of resources available for people, and that's a lot of what you're going to do as a nurse. So personality development starts really early in life, and it's one of those things that we talk about in pediatrics. So generally speaking, your personality is your unique organization of characteristics that determine your recurrent pattern of behavior. So your personality kind of is how you interact with your environment. And there's a couple of different theorists. There's a bunch of different theorists that we're going to talk about in this class. But there's a couple of different theorists, Erikson and Freud specifically, that talk a lot about personality development, and they focus a lot on how your experiences early in childhood kind of influence your personality develop going forward. So I'm going to go ahead and show you a couple of videos. We'll watch one and then we'll talk about it, and then we'll watch the second one. And I like the videos because I just think they do a good job of giving you an overview of the theorist. So I'm going to do Freud first because Erikson actually based his theory based on Freud. So I think it's a good starting point. Let me see here.
Development claims that as we grow up, we pass through 5 critical phases. Our sex drive, which Freud called the libido, focuses in a different erogenous zone at each phase. The phases are called oral, anal, phallic, latency, and genital. If our experience during any of these phases was traumatic, we might develop fixations later in life, such as neurosis, dependencies, addictions, or depression. The oral phase, age 0 to 1. In the first year of our lives, we discover the world through our oral senses. Our main pleasure comes from sucking our mother's breast or a bottle. The conflict that occurs now is the weaning from our primary caregiver. Hans is weaned off his mother's breast without trauma. Ernst's mother stops feeding him within 4 months of birth, which is too early. Ida is often left alone crying when she is hungry. Hans becomes a healthy and independent adult. Ernst suffers from trauma and develops an oral fixation. He tries to compensate for it by chewing gum all the time. Ida spends her entire life looking for the oral stimulation she was denied as an infant, and therefore develops a manipulative and addictive personality. The anal phase, age 1 to 3. The primary focus of our libido at this age is the control of the bladder and bowel movements. We have to learn how to use the potty. Hans' parents praise his attempts to use the toilet and encourage him to learn at his own pace. Ernst's parents force potty training on him too early and punish him for mistakes. Ida's parents neglect any efforts at potty training entirely. Hans develops a competent personality and a good and balanced relationship with authority. Ernst develops an anal retentive personality. He becomes an over-controlling and stingy adult with disgust for his own body and a tendency to obey authority. Ida develops an anal expulsive personality. She becomes messy, disorganized, inconsiderate of other people's feelings, and rebellious against authority. The phallic phase, age 3 to 6. Our libido now turns to the genitals. as we discover the differences between the female and the male gender. The boys' conflict in this phase occurs as a rivalry with their father, also called the Oedipus complex. Ernst and Hans desire to possess their mother and fantasize about getting rid of their father. But they know that their father is stronger and fear being punished for their desire. Freud called this castration anxiety. Ida experiences penis envy. She believes that a penis is the key to power and domination, and also wants one. Hans' father was very present during that phase. Later, Hans resolves this conflict by identifying strongly with him. He learns to take on a male role. As an adult, he respects both genders. Ernst, whose father was absent during that phase, fails to develop a strong sense of manhood. He has a mother fixation and is not sure about his sexuality. He also tends to be aggressive towards women and constantly needs to compete with other men. Ida, like all women, maintains her penis envy for the rest of her life, which in her case causes an inferiority complex towards men. Latent phase, age 7 to 13. In this phase, our libido is suppressed as our sexual energy is being sublimed into developing life skills. Our superego strengthens, and we strongly identify with social values, same-sex heroes, and friends. Hans follows many hobbies. Ernst loves learning at school, and Ida makes lots of new girlfriends. There is no real conflict in this phase. All three of them benefit for the rest of their lives from the skills they developed during latency. The genital phase, puberty to death. Once we reach puberty, our libido starts to become active again, and we develop an interest in sexual partners. Hans, Ida, and Ernst face the challenge of balancing the sexual desires of the id and the needs of the superego to obey social norms. The development of a strong ego helps to find a compromise between the two.
I am actually.
Okay, so what did you guys think? What can you tell me about Freud's theory? Do you think he's onto something? Do you think if you aren't potty trained with positive reinforcement and love from your parents, you're going to grow up to have personality problems? So Zakaya doesn't think so. Zakaya, what do you think? Do you think that those things in early childhood, you know, how you're weaned from the bottle and how you're potty trained, that all of those parenting techniques early in life really influence how you grow up?
I don't think so. I think it's mainly a lot of other factors than to just pinpoint that situation to a troubled adulthood.
Okay, so what other factors do you think influence whether you end up with a healthy personality or a troubled adulthood?
It could be family dynamic. It could be finances. It could be a lot of like your environment.
Okay. So sure, and someone else is going to say something. Go ahead. One of your other classmates is going to add something.
So I was saying just about the environmental factors based on, for example, if you come from somewhere like you said, a loving family, and then you move to maybe a bigger city where people are more aggressive, then by us being human beings, quite naturally, you have to blend in with your surroundings. And it may make that individual change their personality based on where they're located at.
That's true. So I
also,
yeah, go ahead. Yeah.
I think that when they start feeling those things and being treated that way when they're younger, that also help you to start to develop your trust and mistrust factors for when you become older. Because if your mom is pushing you away or you're beaten every time you have an accident when you're being potty trained, that's going to make you feel like, well, I can't trust anybody. At any time I do something, I'm going to be hit on, or nobody's going to want me, and you're going to have self-love issues as well.
And it also makes you, it also can cause you to develop like, I forgot what I was gonna say, like you fear a fear of failure.
Because you don't want to get punished. You don't want,
And that carries over into adulthood for a lot of people. They fear things that are natural.
Right, very good. So both Freud and Erickson, which we're going to do next, they really focus a lot kind of on the early childhood and how that affects you. So I totally understand, the opinion that you could, maybe have a rough patch in infancy, and then, things get better. But just to understand these theorists, they really, really focus on, if you don't have this baseline of like developing trust, feeling that you're secure in your environment, that going forward, that's going to really influence your personality. So obviously, I think Freud is really kind of outdated. Whenever you read about Freud, he talks about like penis envy in the girls, and he doesn't even address people being homosexual and that being normal. So I just want to kind of throw that out there. When you're reading about Freud, just kind of have to take him in, where he was in that time of the world, and how he viewed the world was really based on the social environment at that time. But you do need to kind of understand both of these. I would say that, for the theorist, I emailed you like a word handout that has like the ages and the different stages. So a lot of the test questions are going to be things like, you have a 6-year-old, according to Freud, what do you expect? So you're going to need to be able to put the age of the child with the stage for the different theorists and think about what that stage talks about. I think the two that are most heavily tested are going to be Erickson and Piaget, but it would probably be Erickson, Piaget, Kohlberg, which is the moral theorist that we'll talk about next week, and then those are probably the 3 that are most tested. So just to kind of know that for the theorists, they're on the first exam, they're throughout the class. We go back to these theorists all the time. And I totally understand having different perspectives. Like, no, like maybe your mom was young and she didn't really have time to pay a lot of attention to you when you were little, but then things got better and you ended up being healthy. And I understand why you would have that perspective, but in terms of understanding these theorists, you need to understand that from their perspective, if you don't develop trust, then you're not going to have a sense of hope. Or if you don't develop autonomy when you're a toddler, then you're not going to really feel like you can make your own decisions. So according to these 2 theorists, what happens when you're little really influences the personality that you develop going forward. So thank you for participating. We're going to go ahead and look at Erickson's video. We won't finish Erickson's video because this class is only peds, so we'll kind of cut it off once they're teenagers. And we'll kind of go over, we'll talk a little bit about Erickson again when we're done with the video. And I'm going to apologize to my dogs just got home, so you might see a big dog head show up.
Our growing list of test banks for one in your field of study. Sign up for free at www.learnmytest.com. Erik Erikson adopted the belief from Sigmund Freud that development is characterized by a series of stage-related conflicts between 2 perspectives. He believed that you must hold both perspectives in order to achieve identity strengths, which he defined as virtues. The first stage-related conflict in Erickson's theory is trust versus mistrust, and often occurs between 0 and 18 months. During this stage, an infant must depend on their parents or primary caretakers for basic things such as food, water, shelter, and emotional needs to survive. Children who can depend on their parents for these needs can trust or count on them, while those who can't may have difficulty trusting others now and later in development. Erickson believed that children learn to trust their caretakers, develop the virtue hope, where they view the world as a good place where people can be trusted. The second stage conflict of Erickson's theory is autonomy versus shame and doubt, and occurs from ages 2 to 4. During this stage, children learn to do activities on their own without the help of their parents. For example, children learn to go to the bathroom on their own or learn to dress themselves. Parents who get upset with their children doing these activities on their own may have children who struggle to be self-sufficient later on in their development. However, parents who let their children solve problems on their own when they are ready for them will have children who have the confidence to do things on their own later in development. Erickson defined the virtue for stage 2 as will, or the child's ability to express his or herself by doing things on their own. The third stage conflict in Erickson's theory is initiative versus guilt, and tends to occur between 5 and 8 years of age. During this stage, children take a step from spontaneously doing things on their own to setting goals and working toward them. Little Johnny may want to learn how to ride a bike because he wants to be able to ride down a big hill in his neighborhood. Erickson argued that many children in early childhood, like Johnny, engage in risky behaviors when they set goals. When Johnny tries to ride down the hill, falls on his bike, and gets hurt, he feels guilty that he did not successfully make it down the big hill without falling. He may go home and act aggressively toward his parents because he was unable to achieve his goal. Erickson argued that children in early childhood can often engage in aggressive behaviors toward their parents and others because they are upset with not reaching their goals. He defined the important virtue of this stage as purpose, or having a goal or reason for performing certain behaviors. The fourth stage conflict in Erickson's theory is industry versus inferiority, and occurs from ages 9 to 12. During this stage, children are more receptive to feedback from adults about their competence and begin comparing their achievement and abilities to peers. For example, children learn whether they are more attractive, a better athlete, or a more superior student than the other children in the class. They may discover things that they are good at and should pursue as a hobby. Children who receive negative feedback from adults compared to other children may view themselves as less confident, which may lead them to have a negative view about their ability and not set challenging goals that require them to perform their best. However, children who receive positive feedback from adults in comparison to peers tend to have confidence they need to pursue goals that they need to be successful later in their development. The fifth stage in Erickson's theory is identity versus role confusion. And Erickson believed that it occurs from 13 to 19 years of age. However, Erickson did state that this stage is often prolonged. During this stage, adolescents are setting boundaries with parents, such as having their own private lives with friends and romantic interests. They are also searching for a place within adult society, which can include a search for an occupation, gender, political views, and religion. During this search, children may often experiment with different identities and viewpoints in order to find their true identity.
Okay, so I want to point out a couple things about Erickson. So his stage is always going to be two things, like trust versus mistrust, autonomy versus shame and doubt. And then there's a virtue for every stage. So I want to make sure you guys understand that. So like trust versus mistrust is the first stage, and the virtue is hope. So if you learn to trust your caregiver, according to Erickson, then you have hope in the world. You think the world is a positive place. And the second stage, autonomy versus shame and doubt, the virtue is will. So that you have, if you, are allowed to make decisions, you get positive reinforcement in your potty training, etc., then you have view yourself as being competent of making decisions. So Erickson really viewed, development in these stages, and then like, if you don't have successful resolution of that stage at that age, then, you're going to have problems going forward. So do you guys see similarities between Freud and Erickson? Do you think that they kind of view the world pretty similarly? So I know you guys gave some good points about Freud. What do you think about Erickson's theory? Do you think that he's on to something? It's going to be, your opinion might be similar to what you thought about Freud, but I'd love to hear you guys express some ideas about, if you think Erickson was right, if you think he was wrong.
He definitely has a point with children and the fact of being a positive reinforcement to them. I mean, you can't spoon feed them and sugar feed them all day long because everyone's not number one, but at the same time, even when they're making a mistake, you try to reinforce the positive side of it, of going, we all don't always succeed, but we can keep trying.
Okay. And are you a parent? Just out of curiosity, have you had some experience trying to use these positive reinforcement skills?
Yes, I have 3 and 2 of them are adults already. So I'm doing something right. I'm still alive and they're growing.
Yeah,
But no, yeah, like they want to get, they want to be number one at everything. And you have to sometimes, like we're at this day and age where, you're not allowed to say, hey, you don't get the blue ribbon, but in reality in life, that is the way it is. Not everybody's going to be number one, and we have to be very honest with them. My son just failed his driving test, and I had to explain to him that's life. It happens. Obviously, you have to change up the way you're studying. I can't help you pass it. You have to do this on your own.
Yeah, so thank you for your feedback. And, in terms of toddlers, this is a lot of what you're going to do as a nurse when you're doing that anticipatory guidance, is a lot of that teaching them about positive reinforcement. So it sounds like you're, a good mom and you raise really good kids. So I appreciate, throughout the class, people, always share your personal experiences if they're pertinent to the class. I love to hear it. Some things that I want to point out, since we're kind of into the theorists and talking about toddlers, there's definitely some key things that you need to know. So do you guys know the rule for timeout? Like, how many minutes should a 4-year-old be in timeout?
4 minutes.
4 minutes. 4 minutes.
It's 1 minute for every age and years. And in terms of like development, do you know what sort of language development you would expect for a 2-year-old?
Minimum.
I mean, it depends. Every child is different.
Every child is different, but there are some benchmarks. So we would expect when you're around 2, you should be able to say 2 words consistently, like me go, like 2-word sentences.
Oh, okay.
So if, and that's kind of like, something to kind of remember, like 2 and 2, so 2-word sentences at age 2. So you're right, every child is different. And you're just like, when we were talking about the number 2, you're not going to be like something's wrong with the 2-year-old because he's not using 2-word sentences. But if you notice he's not, then you take another minute to see if there's something going on. So it's good to have like benchmarks where you kind of think kids are going to fall, so that if they're not meeting that benchmark, it doesn't necessarily mean that there's something wrong, but maybe you should investigate more to see if there's a hearing problem or something going on at home, or they're the youngest kid in the family and their siblings talk for them, so that's why they're not saying anything, but to kind of identify what's going on. So we talked about that. So good job. Do you guys have any questions about those 2 theories that we talked about? So I would encourage you to look at the Word handout that I sent you that breaks down the different theories by the different ages. Like I said, there's going to be test questions throughout the term on the theory. So it is something, unfortunately, it does involve a certain degree of memorization, because you're just going to, you need to be able to identify a theory based on the age, and you're going to need to know the differences between the different theorists. So I'm going to kind of wrap up that section on the theories, unless you guys have any more points you want to make. Okay, I want to make sure that we all understand that the 2 that really focus on personality are going to be Erickson and Freud. So we're going to go over some information now about like growth and development, some key points in terms of like feeding kids and stuff like that. There's a lot of PowerPoint slides. You guys have a bunch of resources to look at. We're not going to have time to go over everything that's because there's 115 slides, but I'm going to make sure that I point out some key things that I know you need to understand. So, you know, in the PowerPoint, it goes over the different sort of tasks that they're going to do throughout their childhood according to these theorists. So one thing that, you know, as nurses, we want all of our patients to be healthy, and we talk about, you know, diet and education and making sure parents know. So there is obviously a problem with obesity in the United States, but you really want to make sure when you're talking about young kids that they don't do any low-fat diets. So restricted fat and cholesterol can actually influence brain development. So no kid under the age of 2 should be on a low-fat diet. So you need to make sure that parents know that even though, you know, they could be trying to make their child healthy, you know, the brain's not finishing developing and growing. So in those early couple years, they need those healthy fats in their diet to have normal brain development. So there's 2 different things that can happen. You know, you can underfeed a baby or you can overfeed a baby. So clearly this is our underfed. So we call, you know, we don't really know why someone's too thin. We call it failure to thrive, crying and restless, and symptoms of overfeeding are regurgitation, rapid weight gain, or maybe persistent diarrhea. So you want to, you know, as a nurse, you're going to be educating parents about how to feed and how to recognize cues of satiety that they're full. And we talked about, you know, not doing the high or not doing the low fat diet in under 2, and then also not doing a super high fat diet can cause like a lot of abdominal distension. Sometimes, you know, constipation happens pretty frequently in kids, and sometimes it can just be because of what their diet is. So that's one of the first things that you're going to look at if the parent complains that their kid is constipated. So in terms of formula and breast milk, it says it on here, but I want to make sure you all know that you never give milk before, like cow's milk, before they're 12 months old or 1 year. Does anyone know why we don't give cow's milk to babies?
Is it for allergies? Is there an allergy?
Yeah, they could develop an allergy. Yep, that's one reason. There are a couple reasons. What's another reason?
Is it too much fat?
Break it down.
They have a hard time digesting it, for sure. It doesn't really have very much iron. And also because of the digestion, they can end up with a little bit of like a mild gastric bleed. So they can end up with an anemia and a combination of the lack of iron and the fact that they can't digest it, and it causes some upset gastritis. And so no milk from the carton until they're at least a year, and then no low-fat milk until 2 years. So those 2 years, again, that's the whole reason that they need some fat in their diet with their first 2 years for their normal brain development. And what can you guys tell me about feeding kids? How many months do you usually wait? Like at what age do you start introducing food to babies?
6 months.
6 months, very good. And what's normally the first food that you introduce?
That oatmeal.
Rice
Yeah,
cereal.
Rice cereal. I heard oatmeal. We normally recommend rice cereal, and rice cereal has a very, very low allergy profile. So almost no one is allergic to rice cereal. So that's why that one is chosen. And then how often should you introduce new food?
1 food a week.
1 food a week is a good rule. We say 4 to 7 days, but 1 food a week is a good rule. And why do you wait in between introducing new foods?
To pinpoint
Allergic
allergies.
reactions. If they have a reaction.
Yeah. So you know, you want introducing foods slowly, making sure they don't have allergies. Generally speaking, we want to try to target what we're doing to their age. So kind of remembering that toddlers like finger foods, they like to be able to feed themselves. We say that by the end of, by the time they're 2 years, they should be able to eat by themselves, not necessarily with a knife and fork, but they should be able to feed themselves. So, once they're feeding, you want to give them like a variety of foods, etc. So, part of nursing care is focusing on the teeth. So making sure that parents know not to neglect baby teeth. Does anyone know when kids normally start getting their baby teeth? When do they normally come in?
About a year?
So they
About
start getting
6 to 8
Yeah.
months.
very good. So I would remember 6 and 6. So they normally start getting their baby teeth around 6 months, and they normally start getting their deciduous teeth or their adult teeth when they're around 6 years. So just kind of have those, like sometimes they'll get a little bit early and sometimes it'll be a little bit later. But you know, if you have a 1-year-old that doesn't have any teeth, then you would be concerned and you need to investigate why. So they should start tooth care as soon as they're getting any teeth. You know, start cleaning up. Trying to avoid things like sticky foods, sugars. You want to make sure they're brushing their teeth. You also want to make sure that they're not going to bed with a bottle because they can get cavities from that. So when we're talking about kids, we talk a lot about play, which is really important for kids because that's how they learn about their environment. So, you know, just consider that play is the work of kids. Even if they're in the hospital or whatever, they still need to have that opportunity to play. So, you know, encouraging them to play kind of helps them stay developmentally on track. And making sure that you kind of know where they are developmentally so you can help parents choose age appropriate toys, etc. So that is the basic information on growth and development. There's 2 more chapters, and we're going to go over some infant stuff, and then I'll point out some things for toddlers, but we won't have time to go over everything. But when we talk about infants, we talk about milestones a lot. So, you know, somebody mentioned, you know, like I asked, like, how should a 2-year-old talk? He's like, well, all kids are different. And that's true. All kids are different. But you should have some key things that should be happening throughout childhood. So if they're not happening, if they're not meeting those norms, you can investigate. So those key factors are called milestones. So there are certain things that you expect at certain ages. And then both Erickson and Freud talked about this, that sucking is really important for babies. So, you know, sucking on a pacifier helps calm them down, or eating or sucking also helps calm them down. So if they're in the hospital and they're not allowed to eat, you need to make sure that they still have a pacifier to suck on. We have what's called like sweeties, which is a little bit of sugar water, so put something sweet on the pacifier and then putting it in their mouth kind of helps them, can lower their pain threshold, makes them feel more comfortable. They also really like their hands. So if they're in the hospital, you want to try to leave their hands free so they can still explore their environment. So generally speaking, you know, they're born with reflexes, and then as they get older, they end up developing more purposeful movement. So an example of this is like the grasp reflex. So the grasp reflex, you have a baby and you put something in their hand and they grasp it. So that goes away when they're around 3 months old, but then they start having prehension, which is when they grab things intentionally. So, you know, kind of knowing these key features about babies and seeing if they're kind of following that development path that you expect. So the parachute reflex, this is a picture of the parachute reflex. It's actually like a protective mechanism. When you flip them over, their arms and legs go out to protect themselves from hitting their head if they fall. And then the pincer grasp is the ability to pick stuff up with their finger and their thumb. So, you know, there's certain things that we need to do in terms of educating parents. Consistency is really important. This is kind of getting back to Erickson and Freud. Having a consistent caregiver, they know that when they cry, they'll be picked up. They know that they're going to get fed, they're going to get their diaper changed. All that kind of really influences how they're going to develop after infancy and what sort of relationships they're going to have with people and how their personality is going to develop. So always making sure parents know that, you know, you can't really be strict with the baby. They're crying for a reason. So if they're crying, they need to be picked up, they need to be soothed, have their diaper checked, maybe check out if they're hungry. And babies are really able to respond to that consistent, loving interaction with the caregiver. Having said all that, you know, we want to support parents as much as possible, make sure that you're addressing any issues that they might have so they can provide the best care possible, and making sure that we know that no 2 babies are the same. parents, giving them the resources. Talked a lot about feeding in these guys. So this is a phrase that I know you're going to see again, and it's called the lethargic infant. So the lethargic infant is a baby that's kind of shut down. They've been overstimulated and they don't want to interact with their environment. So if you see this is going to be like a baby that doesn't want to look at you in the eye, is not responding. So you want to make sure that you're kind of shutting down the overstimulation, avoiding bright lights, moving the baby gently, talking in a calm voice, making sure that you're slowly dressing and undressing them. And then also this is one because there's sometimes test questions on this. Sit the infant upright at intervals. Even though you want to kind of like minimize the stimulation, you still want to kind of like let them sit up and look around at intervals so that they can interact with the environment, but you don't want it to be so overstimulating. So this is just kind of like some key points if you have a baby that's kind of shut down and not wanting to interact with his environment. So one of the things that's super, super hard for parents is sleep patterns of babies. So who's a parent in the group? How much did your newborn sleep when they were first home from the hospital? How many hours?
It seems like never.
It seems like never. Okay, very good.
Well, mine
So,
slept all the time. I don't know.
oh, really? But for several
Both.
hours at a time, or just kind of would
Both.
nap a lot?
No, both. I would have to wake them up.
Okay, that's kind of unusual. Most
Mhm.
babies sleep for about 4 hours max. So this is something that you need to make sure parents understand, because whether you're breastfeeding or bottle feeding, you're going to get up at night to feed your baby. Babies they're just not kind of programmed to sleep through the night. So you don't really expect them to sleep through the night till they're more like 4 to 6 months. So this is one of those anticipatory guidance things. You need to make sure that parents understand that. And then why do we want babies on their backs on a firm mattress?
Sudden infant death to
Sudden
decrease
infant
that.
death syndrome. Very, very good. Okay. So as nurses, you want to make sure babies are coming in for their well child checks. We always do immunizations at well child checks. Does anyone know anyone that doesn't want their child immunized? Have you ever had to work with someone that was an anti-vaxxer?
Yes.
Yes. How was it?
To me, I worked at my mom's daycare for 20 years, and we had a family of 4 that didn't get vaccinations, and it seemed like they were always sick, if you ask me.
Okay, I appreciate your yes. So vaccines, you will see this. There are a lot of people out there at all education and socioeconomic levels that don't believe in vaccines. So you need to sort of understand how vaccines work so that you can educate people. So vaccines help prevent against ear infections. They help prevent against meningitis, pneumonia. So, your comment that you thought they were always sick, it's quite possible because they really do help bolster kids' immune system. So this is one of the main things that we're doing as pediatric nurses, is really educating people about vaccines and making sure parents are coming in for their well child checks. So weight, height, head circumference at every visit until age 2, and also kind of paying attention to hearing and vision, nutritional counseling if needed, making sure the family has those resources if they're having problems with finances or anything like that. And I think we talked about teeth, toddlers. Okay. There's a couple things, a lot of things that when we do as nurses, as we make sure that parents kind of have all the tools that they need to do the best job they can. So you want kids to eat a well-balanced diet. So we generally speaking, once you're introducing foods, you do the food first, and then later you give them their milk, because sometimes they don't want to try food if they're full from their milk. So if you kind of use that technique, then they're more likely to have a balanced diet and try a bunch of different foods. And there's some key things about diet and nutrition in childhood and toddlerhood that we need to know about. So infants require more calories per kilo than adults. They're growing really fast, so they have higher energy needs. We talked about the fact that they need those digestible fats for their brain development, so certainly not doing anything low fat until they're over the age of 2. And then, trying to focus on having a well-balanced diet once you're introducing foods. So I'm going to go ahead and show you the slide here. This has some key benchmarks that I know that you need to know. So a baby's weight should double by 6 months and it should triple by 1 year. So if you're ever given a test question when they're like, the baby was 6 pounds, 4 ounces at birth. If it was 6 pounds, 4 ounces at birth, how much should the baby weigh at 6 months?
12 pounds.
12 pounds. And then how many ounces?
8 ounces. Did you say 4?
Yeah. And how many ounces are in a pound?
16.
16. So you might see questions where you're going to have to add the pounds and the ounces, and then maybe add, additional, making sure that you know that it's 16 ounces is 1 pound. So doubles by 6 months and then triples by 1 year. So babies are born with a really, really big head, and then it kind of evens out as they get older. So their head and their chest are equal by a year. And then babies they get iron from their mother. So they have iron stores that they're born with, but then that's gone by about 6 months. So what do you think you can develop if your iron stores are gone by the time you're 6 months?
Anemia.
What might happen? Yeah, you can get some iron deficiency anemia. So most infant formula, like standard off-the-shelf formula, is fortified with iron, but breast milk isn't. Obviously, it's breast milk. So sometimes pediatricians recommend iron supplements in breastfed only infants starting around 6 months. And then, they don't really have depth perception until they're around nine months. And these are some key sort of points about like development. So older infants, around 4 months, they can roll over. So if a 6-month-old infant that's not rolling over, that's one of those red flags that you should intervene on. How many months do you think you are before you can sit up? All of you guys that have been parents, when did your baby start just sitting there by themselves?
About 8 months.
About 8 months. Very good. And when should babies be able to take some steps?
About a year.
About a year. So those are some key things that you need to kind of think about. If you have a 10 or 11-month-old baby that's floppy and won't sit up, then maybe something's going on that you need to intervene at. And then I talked about the 6 and 6. So 6 months is when they start getting teeth, and around 6 years they start losing their teeth and getting their adult teeth. So we're going to go ahead and do a Kahoot that I know has a lot of the information on your quiz. So I'm going to pull it up here, but there is one theorist that's on your Kahoot that we didn't talk about. So I'm just going to mention him briefly. So Kohlberg is the moral theorist. He talks about why we develop a sense of morality. And younger in life, before like you're really school age, children make decisions because they don't want to be punished. That's like the first stage of Kohlberg. Like a 2-year-old doesn't know the difference between right and wrong, but the 2-year-old knows if he writes on the wall, he's going to get in trouble. So then he doesn't write on the wall. So the first stage in Kohlberg's development is fear of punishment. And that kind of drives why it is that they follow the rules. So I'm going to go ahead and pull your Kahoot up, and I'll make sure I share it with you in your announcements.
Ooh.
Okay, I'm gonna go ahead and hit start here. Oh, someone just joined. So the nurse explains that permanent teeth begin erupting at what age? 4 years, 6 years, 8 years, or 10 years?
Wait, what?
Six.
Yeah, very good. So it's around 6 years. So 6 months for baby teeth and 6 years for adult teeth. So what does self-feeding help develop in a toddler? Good nutrition, adequate height and weight, a sense of independence, or healthy teeth? Excuse me.
6.
Independence.
You're supposed to click the answer on the Kahoots.
Very good. Yeah. So, right. So if you shout out the answer, then you can give the answer away to your classmates. So if you have the Kahoot on your phone, has someone in the class not done Kahoots before? So
See.
you can't what?
So I've got it on, but I'm not able to see it on both, and my phone is not downloaded on my phone, so I didn't get it in time.
Oh, okay. So if you can just pay attention, and I'll put it in the announcement so you can do it again at home. So, but it does work best if you have it on your phone, and then you can choose the answer on your phone and then look at the computer screen that you're doing in class. And if you could not shout out the answer, that would be great, because then your other classmates that are doing it on their phone can try to choose the right answer. So you guys are right. So a sense of independence. This really gets into Erickson's autonomy versus shame and doubt. If they're able to feed themselves, dress themselves, learn to potty train, then they develop that sense of independence when they're a toddler. So why is the 4-year-old child likely to obey rules? They respect authority figures, they don't want to be punished, they want to please adults, or they believe that following rules is right.
This one. The child respects.
Right. So this is the kid, the first stage for Kohlberg is they obey the rules because they don't want to get punished. That's the first stage of moral development. So what is the earliest age at which an infant is able to sit steadily alone? 15 months, 8 months, 5 months, or 4 months? Very good. 8 months. So what is an abnormal finding in the evaluation of a 6-month-old? Head leg is present, weight gain of 4 to 7 ounces per week, length increases by 1 inch in 2 months, or they can sit alone for a few seconds. Good. So head leg is present. So a 6-month-old, they might be able to sit alone for a few seconds, but they wouldn't really sit there independently until around 8 months. So what is head leg? Who can tell me what head leg is?
They're not picking it up.
Okay. Yeah. And what do you do to help babies have neck control? What sort of intervention do you do?
Tummy time. Like a
Tummy
support.
time. Yeah. So you put them on their tummy. If they're on their tummy, they're going to kind of do this roll where they put their arms down and they kind of lift their head up. So you test head leg, the baby's laying flat, and you grab them by their arms and you kind of pull them up. And if their head stays back, then that's head leg. And that's an indication, you know, maybe they have a muscular problem, but maybe they just need more tummy time. So this is one of those things that, you know, at 6 months, they should certainly be able to hold their head up. So that if they're not able to as a nurse, you need to do some more investigation to try to see why. So how many hours should a toddler be able to stay dry for the nurse to suggest they're ready to begin potty training? 3 hours, 1 hour, 4 hours, or 2 hours? So yeah, it is actually 2 hours, which doesn't seem like a long period of time. So certainly if they're not staying dry for 2 hours, then you don't want the parents to start potty training on them yet. So how many minutes should a 5-year-old be in timeout? 15 minutes, 5 minutes, 10 minutes, or 7 minutes? So it is very good. One minute for every age and year. So it's 5 minutes. What type of family consists of 2 parents with children from previous relationships? A blended family, a nuclear family, an alternate family, or an extended family? So that is a blended family. Very good. And who can tell me what a nuclear family is?
The
What does that mean?
traditional
Traditional.
mother, father.
Mother, father, and kids. And how about an alternate or an alternative?
Adoption.
Maybe adoption. Generally, they talk about like maybe as same-sex couples, or maybe a parent that lives with a friend and that parent is helping to raise them. So alternate is anything that's not mom, dad, and the 2 kids. And then extended family or kids. What would an extended family be?
Grandma, grandpa, aunt, uncle.
Yeah. And we talk about extended, we're talking usually about multiple generations in the same household. So an infant weighs 6 pounds, 12 ounces at birth. What should that baby weigh at 6 months?
Oh, snaps.
All right. So yeah, so the 6 is going to be 6 times 2 is 12, but then 12 ounces is going to be 24 ounces, then there's 16 ounces in a pound. So you're going to have to subtract 16 from 24 and see that then you have another 8 ounces. So 13 pounds, 8 ounces, or 13.8 pounds. All right, last one. So what is an example of proximal distal development? Dexterity with arms before hands, head control before trunk control, vocalizing words before forming words, or walking before running. All right, so this is the dexterity with arms before hands. So closer to the midline before the extremities, the outer hands, feet. And what would head control before trunk control be? What type of development is that?
Cephalocaudal.
Cephalocaudal. Very good. All righty, good job. Who's Italian mama?
Me, Jessica.
Jessica, very nice. All right, so good job, you guys. Does anyone have any questions about what we talked about in class today?
No, man. Oh, I have a quick question.
Yeah, go for it.
It has to deal with our calculations assignment that we have to do.
Okay, yeah.
And it says that it's edition 7 for our calculation book.
Okay, and you have a different edition?
We have edition 8 is what they gave us, is what I guess we're
Okay.
using now. And my whole question is in the back, we don't have chapter 25. It stops at 24.
Okay.
And it doesn't quite line up.
Okay, I got an email about that, so I'll post an announcement that tells you what pages you need to look at. Thank you for asking me.
Well,
Yeah.
so it's not gonna be the 7th because I have the 7th.
If you have the 7, you can just follow the what says in the syllabus, but for those of you that have the edition 8, I'll post an announcement.
And Professor Bruno, like, how do you want us, can we like, show the work, scan it, or do you?
Yeah, any way that you can do it, to be honest with you, is worth 0 points. So I want everyone to do it because every single test has 10 points of math problems. So knowing how to do the work is really important, but it's not worth any points. So however you upload it, I will look at it and give you feedback. But the
Okay.
most important thing is that you know how to do it.
Okay, so we don't have to show work.
No, I mean, I don't want to lie to you. It's not worth any points. So,
Okay.
but if you don't, this is the thing. If you don't know how to set up the dosage calculations, you won't do well in the class.
Right.
Because there's 10 points on every test.
Oh, okay. Okay.
So there's always 5 questions. They're worth 2 points each. So like if you can't do them, you're going to get a lower grade on every test. And they're not multiple choice. They're fill in the blank. So I encourage you to do it. Because you definitely need to know how to do it for the test. Okay. Does anyone else have any questions? No. Okay. So if you have any questions, send me a message, send me a text message. I'll put a video link for the class and the Kahoot in the announcement. And then, like I said, if you have any questions, let me know. And then please remember that your quiz 1 will be taken in class time tomorrow. Okay. Or not tomorrow, next week. All right, you guys have a good week. I'll see you next week.
Have a good week.
Bye-bye.